And welcome back to The Factor Uncensored. More and more people are testing positive for COVID-19 here in Houston. The positivity rate is damn near 30%. We find out the latest and what you need to do now to avoid the sometimes deadly disease.
So what is this wave of COVID we're seeing again?
That's correct, Isaiah. We've seen a significant increase in the number of cases. And that's partly due to a lot of events that have recently happened in the city. We just underwent multiple parades that happened, and then recently we had July 4th as well. And so folks have essentially let down a little bit of their guard as it relates to the COVID. And because of that, we're seeing a lot more cases now on the rise. The daily cases load of COVID cases are 2,000 to 2,200. That is significantly up from last month and even the month prior, where we were tinkering around 1,000 cases a day. I anticipate, Isaiah, that the cases are actually a lot higher than these 2,000 and 2,500 that we're getting. And the reason is because people are testing at home, and those data is not transmitted to the government, to the state, and et cetera. And so therefore, I do believe that the cases are a lot higher. Folks are transmitting the COVID a lot higher to other folks. And that's just really where we're at right now.
Do you think also because we're traveling around more now as we were before the pandemic, and people are flying more, face coverings are not required on airlines, and so a lot of people are being exposed? That's
correct, Isaiah. Thankfully, a lot of these folks have either been vaccinated or have had some sort of vaccine, and that has been protecting them from having serious complications from this virus. And so though we're seeing a number of cases on the rise, we're not seeing that significant spike in hospitalizations at this time. That is good news. That means that folks are getting vaccinated or have been vaccinated, and because of that, their severity of their symptoms are a lot less than they would be otherwise.
Now, I remember you saying that Omicron was much more contagious and it can pass along to someone very easy. Are we seeing more Omicron cases, that form of COVID-19?
We're seeing that, Isaiah, as well as newer variants of it. As we've spoken before, the Omicron and COVID itself, there's different mutations that are happening. There's different variants that are constantly coming out. There's a new variant in UK that is spreading rapidly as well, and it's made its way here. So we've seen an increase in those cases here. And Omicron is still here. It's still transmissible. It's still spreading around and affecting folks, but now there are other variants that are kind of making their way as well.
Now, a lot of people are saying, and these are people I know personally saying, I didn't go to many places. I didn't go into the public that often, and how did I get it?
Isaiah, it's some of the things that we take for granted, right? Shopping, filling up gas at the gas station, those pumps, those shopping carts. Those are things that are, carry the viral load there, and they are transmissible that way. And so it's some of the things that we're doing on a regular basis that we may not be thinking. Going out to eat, going out and doing other activities that may have that viral load still there on those particles.
Or simply going to work every day. You just never know. Dr. Danish Ali, what would be your best advice to deal with this current situation if you haven't been affected as of yet?
Isaiah, the current advice is still to get vaccinated and also to get boosted if you have been vaccinated. Look at your status, call your pharmacy and see where you are. If you're eligible for booster, get that booster, and also continue to wear your mask, because these are things that can protect us. They can protect the severity of our symptoms and protect the loved ones that we're around.
All righty. Dr. Danish Ali with Arch Point Pain Institute. Always good to see you. Thank you for your time and your advice, sir.
You have to be careful out there.